Hello, today I'd like to talk with you about psychological disorders in childhood. There may be a tendency for us to overlook psychological disorders sometimes in children, in part because we may not expect them to experience psychological disorders, but also because their symptoms may present differently. Children are not as cognitively advanced as adolescents and adults, and in part for that reason, their psychological disorder, say uh, an anxiety disorder or a mood disorder involving depression, may be more likely to express through their body through physical symptoms like a stomach ache. Also, in the case of disorders in children, there may at times be a tendency to misdiagnose a disorder because how that disorder is expressed more may be expressed more through the body than through more emotional or cognitive symptoms. About 5% of children do suffer from childhood depression, and about 13% suffer from anxiety disorders. And then, of course, there are other disorders that are more unique to childhood, like, say, separation anxiety disorder, attachment disorder, elimination disorders, neurobehavioral disorders like attention deficit hyperactivity disorder and autism spectrum disorder that have their origins in childhood but may be lifelong conditions. Interestingly, in the case of depression, about equal numbers of boys and girls suffer from depression in the preteen years. But when we get into adolescence, about twice as many girls suffer from depression than boys, and that's also true in adults. About twice as many women suffer from depression than men. So there's a lot of controversy surrounding the treatment of psychological disorders, especially regarding the use of medication. No doubt medication can be helpful in the treatment of psychological disorders in children, but less is known about the long-term effects of medication in the developing child. So it's not the easiest decision to make for a parent about whether to allow their child to be placed on medication. In addition, for children who are depressed, who take medication, there is some concern that it may increase suicide risk, at least in some children and adolescents, on that medication. So if you were a parent of a child who is struggling with a psychological disorder, making that decision about whether to place them on medication or not would not be the easiest decision to make. Of course, there are psychological approaches to treating children that have been developed and found to be helpful. And sometimes children are taking medicine and getting help through psychological treatment approaches as well. And of course, involving families in the treatment process is also important and can make a positive difference. I wanted to talk a little bit about two neurobehavioral disorders. One of them is attention deficit hyperactivity disorder, and the other is autism spectrum disorder. As I'm sure you're aware, ADHD is a problem that many children struggle with. It's estimated that about 9% of children and teenagers suffer from ADHD, with boys being about twice as likely to be diagnosed with the disorder than girls. Some children have primarily hyperactive impulsive symptoms, Others have primarily inattentive symptoms, and then there are some who have a combination of both hyperactive, impulsive, and inattentive symptoms. The two main treatments for ADHD are the use of psychostimulant medication, like, say, Adderall, and the use of behavioral therapy. Combining these two treatments has been found to produce the best results for many children, because the medication helps to impact what's going on in the brain, and the behavioral therapy helps the child and those working with the child to develop a more consistent approach to helping the child to develop better self-regulation skills and have more successes in their life. It's interesting to look at research on the brain in relation to children with ADHD, because it has been found that in the prefrontal cortex of the brain, that's the area that helps us to kind of put the brakes on our behavior, self-regulate our behavior, and also to focus our attention. And it seems that that area of the brain is underactive in children with ADHD, involving underutilization of the neurotransmitter dopamine. So medication for ADHD helps to increase dopamine activity in that area of the brain, which in turn supposedly helps children to be able to focus their attention better and to have better self-regulation skills. Autism spectrum disorder previously was called autism, and then there was another disorder that was called Asperger's for children who are high functioning with autism type symptoms. But in the newest version of the Diagnostic and Statistical Manual, the 5th edition, the term autism spectrum disorder is used, that encompasses more severely disturbed autistic individuals, but also those at the higher end of functioning in the autism spectrum who were previously referred to as Asperger's disorder. One aspect of autism that I wanted to comment on, because it relates to something that we've talked about earlier, and that is the lack of theory of mind in children and adults with autism. If you recall, around the age of 3 to 4, children develop theory of mind where they have an understanding that other people have intentions different from their own. But there is one group of individuals who are lacking in theory of mind, and who, if they develop it at all, it's much later in life, and that is individuals who are autistic. So it's very difficult for someone with autism to perhaps even impossible, for some to be able to really think about things from the perspective of another person. They're not able to relate to other people in the way that the rest of us can. I read once about an autistic individual who was asked what they thought about when they saw another person, and they put it this way: when I see other people, what I see is bags of bones in sacks of skin. This gives us a sense of how an autistic individual might view other people, and of course they do have great difficulties in their interpersonal relationships. So that's all for now. I look forward to talking with you again soon. Thank you.